Procedure called a balloon sinuplasty is used to relieve chronic sinus problems.
Our next guest was the first one to introduce the technique here in Wisconsin, but recently underwent the procedure himself. We are here with Dr. Kandula, a board-certified ear, nose, and throat surgeon from Advent. And that's one of the things that always has impressed me is that you do these procedures, you're very educated about it, sort of a pioneer, especially in our state, but you've had sinus problems yourself, so you speak from experience.
Yeah, absolutely. I mean, that's sort of the why I'm passionate. I guess it's one of the reasons I'm passionate about what I do is because I've been on the other side, and yeah, I know what it's about. I know what it is like to be on the other side. And so my original surgery, I had sinus surgery back in 2011, so 5 years ago now. That was a game changer for me, and this wasn't, so we're going to talk about this in a second, what I ended up doing a month ago wasn't like, you know, sort of reinventing the wheel. It was just kind of a little touch-up work from where I was, and where I have been compared to where I was, night and day difference. I mean, so over those 5 years, no sinus infections. I used to get migraine headaches, you know, once every quarter, no migraine headaches, breathing better than I ever have. That's great, but over the last year or so, a little stuffy on the left-hand side, a little bit of sinus pressury stuff coming back, and so it was kind of, that was sort of, I'm a little hypercritical too on, you know, if we got an issue, let's fix it.
Yeah. So you had traditional surgery in the past, and then you did the balloon sinuplasty. When people think of surgery, they think of cutting. Is there cutting involved with the balloon sinuplasty?
None at all. So what changed, we've been able to do balloon sinuplasty in the office for about the last 5 years. So right after I did my surgery, we could start doing this in the office, and so I kind of missed that window of being able to do it. And so part of doing it or having it done to me was sort of what would it feel like?
Check it out.
Check it out. Also, I narrated the whole way through, and so it was kind of one of those things where we kind of flipped the script where I've done plenty of procedures where we filmed them and I've, you know, narrated what I'm doing, but to have it done to you and narrate that, and sort of we thought that'd be neat for our patients.
Were you talking during it?
Yep. Yeah.
All right, we have the video, so let's go ahead and take a look at it, and then we'll talk a little bit more about it.
All right. So he's finding my forehead sinus on the right-hand side, and now
a little pressure.
So we're going to feel pressure. Feels like kind of little pins and needles up there, otherwise nothing much going on. And I'll feel that coming down.
Pressure.
Coming up again. So I feel that same thing, little kind of pins and needles up in the forehead and going down.
A little pressure.
And once again, I don't really feel much. I can kind of hear that creaky sound. Otherwise, that's the sound of that sinus area just kind of opening up. So
you're in the chair.
Yeah, that's
me. And that's not you doing the procedure.
Yeah, that's Dr. Rossiter. So he's our associate over in Mequon. But yeah, that was, and I wasn't sure, like the, you know, sort of technology-wise, if I was going to be able to do that, because you've got somebody in your nose, but it actually worked out fine, and it was really no big deal.
You didn't sound like you were in pain.
No, absolutely not at all.
What part of the procedure was that?
That was the actual dilation. That is the action step of doing it. So, and it was really, you know, like I said, nothing.
Do you find that your patients have a similar experience where they're kind of surprised when you're done that, hey, it wasn't painful?
Yeah, usually there's a lot of anticipation because you don't know what what is that going to feel like. Again, that's part of one of the reasons why we wanted to do this, was sort of say, well, this is what it feels like, and everybody's different. So, you know, that's my experience. Is it really, honestly, was no big deal at all. You know, some folks are going to be a little bit more sensitive than others. We numb up everybody as thorough as we can. So yeah, and numbing for the nose is nice because most of the numbing is just spraying numbing medicine in the nose. So the nose really accepts that stuff nicely, and so yeah, I mean, we numb it up in order to do it, but the numbing medicine does a good job.
How long does that procedure take?
The actual literal doing about 5 to 10 minutes. The numbing process about a half an hour, and there's about a half an hour on the back end where we just kind of keep an eye on things. But
what about the recovery after the procedure then, the downtime?
None. I mean, for me, none. I mean, so I was back to work the next day, you know, worked out the next morning. I always work out in the morning, so did my thing, and I did 4 of these cases on the next day. And so
you work out today?
I did. Every morning.
Wow.
Every morning.
Can't you tell?
4:30 every morning.
No way.
Every day.
Whoa.
Every
4:30.
day.
What time do you go to bed?
Too early.
Yeah, like 8?
Well, last night I watched the game, but usually about 9:30, 10. Yeah.
I go to bed at 9:30, 10. And I'm not getting up at 4:30.
Hey,
that's crazy.
That is impressive.
So all that was done right in your office, though, and that's typical.
That's typical. That's what's changed since I had my surgery, is we do most of these things in the office. You know, certainly folks need surgery these days, too, and I do plenty of those in the OR as well, but it's been a big game changer.
Yeah.
And to be able to go back to work and resume your activities.
Yeah.
Well, that's the thing. I mean, if you can get better, if you can, you know, have something done that's going to make a big difference for you, you can stay up and running, you know, it's all good. which is a good thing.
And who's a good candidate for this particular type of procedure?
So for this particular procedure, folks who are having chronic issues nose and sinus-wise, that could be sinus infections, that could be headaches, that could be pressure, that could be stuffiness, that could be almost anything that as it relates to the nose. And, you know, it doesn't mean this is the right fit for everybody. What I would say is this is a fit for a lot of folks who've been suffering from issues. And, you know, it's not, again, not nothing. That's not like you're going through nothing, but it's fairly low key for the upside involved. It's been a month now, so we did this on May 19th, and, you know, it's been nothing in the moment, very mellow on the back end, and that little bit of, you know, sort of something going on my left-hand side is, you know, nothing again, which is a good thing.
Impressive.
That's great. Love that you did that and filmed it and spoke through it.
Yep.
Here's the information for Advent. It's advent.md, the doctor who does the procedure on himself. You know, he knows what he's doing, right? Mayfair Road in Tosa, also Port Washington Road in Mequon, 2 locations where you can go in for ear, nose, and throat issues. Don't suffer. Give them a call.
Well, and when he says this won't hurt a bit, you can trust him.
Yeah.
He's had it done.
Pins and needles,
Yep.
right? That's what it was. A little pressure.
A little pressure,
Yeah.
not bad.
Great
Yeah.
to talk to you.
Yeah.
Thank you so much.
Yeah, thanks for having me.
Doctor.